welcome, welcome. The first thing I want to do is introduce myself. I am Dr. Yolanda Hancock in social media, known as Dr. Yola. I am first and foremost a mommy. I have a 9-year-old little one who is now in 4th grade, and I always have to acknowledge the fact that she made it on honor roll last week, so I'm always tooting her horn. And I am a pediatrician. I've been a pediatrician now for almost 20 years. Trained at UCLA, did my pediatric residency training at Cedars-Sinai Medical Center, and then moved to the DMV to work out in the community for over 15 years. I worked in Southeast DC, Southeast Washington, DC, and now have my own practice out here in Maryland. My other hat is that of a public health expert. I get to teach the next generation of public health professionals at the Milken Institute School of Public Health at the George Washington University, but I also get to work in, for, and with my community as we navigate through things like the COVID-19 pandemic, really being able, hopefully, to serve as a resource. So what we're going to do this evening, in order to honor those who submitted questions ahead of time, and this may actually answer some of the questions that you guys have who are watching live, I'm going to ask or answer a couple of those questions. I'll read the questions first and then answer them, but also give you guys an opportunity to answer or to ask questions as well. So let's jump in because we have until 8, and I want to make sure that we get folks to bed on time, those of us who have little ones, right? So first question, this is in the COVID/flu vaccination consideration. My child is getting vaccinated next week. How long should I wait until I get him a flu shot too? So here's the thing, little ones and adults can actually get both the COVID-19 vaccine and the influenza vaccine at the same time. And I know some folks are like, oh my gosh, Dr. Yola, that's way too much on the immune system. But anyone who's had a little one knows that from the time a little one is around 2 months old, we have given our little ones a combination of vaccines, and our children have done just well. So this concern around sort of overstimulation of the immune system, particularly when you're giving just those 2 shots, it's not a concern either in the pediatric population or in the adult population. As a pediatrician, I have given for the 2-month-old visit, you get diphtheria, tetanus, pertussis, polio, Haemophilus influenza, Prevnar, hepatitis B, and a rotavirus vaccine all at the same time. And although there have been some concerns around giving too many vaccines and perhaps linkages to autism, what I will tell you is that over 1 million children have been studied between the past 10 to 20 years, and there have not been any viable studies, right? The studies that are done in respected journals where it's peer reviewed, there have been no evidence-based studies to show that there's a link between autism and too many vaccines. So you can get the flu shot and the COVID-19 vaccine at the same time. But if you're concerned, which I can completely understand parents to be, you can give them separately. The recommendation is to wait about 2 weeks because if any badness, either a significant side effect or what we call an adverse outcome, something really, really significant that likely brings your kid to the pediatrician or to the emergency department, those usually declare themselves. They usually show up within about 2 weeks. And we want to make sure that if we give it separate, we don't confuse the picture. We want to give enough time to be able to observe if there has been a reaction. If you do get both the flu and COVID-19 vaccines at the same time, what we do recommend is that you get one in one arm and one in the other, so that if there's an allergic reaction or anything like that, we'll be able to say, okay, they got the COVID-19 vaccine in the left arm. We see this huge patch of hives on the left arm. That's likely to signal some sort of an allergic reaction, especially if it's localized. So you can get them at the same time, but if you decide to wait to separate them out, we recommend about 2 weeks, all right? Next question, my son had a bad reaction to the flu shot once, so I stopped taking him to get it. Will he have a similar reaction to the COVID vaccine? That's an excellent question. What we know specifically about the flu shot is that the flu vaccine is usually grown in egg. And so for children who have an egg sensitivity, or you learn that they have an egg sensitivity is through receiving the flu vaccine, we usually recommend that they not get the flu vaccine again, especially if they had a significant allergic reaction. With the COVID-19 vaccine, Although we still recommend that you get the vaccine, it's important to talk to your healthcare provider to make sure that there's a plan. Like, this isn't the child that I would have the vaccine given at a community site. Instead, I'd have them get the vaccine within the space of their pediatrician's or their other healthcare professional's office, so that if an allergic reaction develops, they have access to care immediately, and it's in a trusted place like your pediatrician's office. With the vaccine, the COVID-19 vaccine, there's a little bit of salt, sugar, and something called lipids. The salt and sugar help to maintain the pH balance, like shampoo, of the vaccine, so that the body doesn't break the vaccine components down before our bodies have enough time to create an immune response. The lipids provide a coating to protect the vaccine as it is entered into the body, so that we can develop an immune response, again, so that the vaccine does not get broken down before we're able to mount an immune response. The vaccine is booted out of the body in about 2 to 3 days. So it's not like it accumulates in the body to develop an allergic reaction like days to weeks later. One of the other things that folks have been concerned about, especially in social media, is this whole idea of nanoparticles, as if nanoparticles mean some sort of magnetic force or microchips. Nano just means small and particles mean pieces. So the fat lipids that coat the vaccine, that's what the nanoparticles are, just in case you guys hear that language out in social media. Any questions about that? Hello, welcome Brown family, welcome iPhone family. Good to see you guys. Let me know as I go through. So what I'm doing right now is going through previously submitted questions. If you have any questions about what we're talking about in answering these questions, please feel free to unmute and ask your question, okay? The next category is really important for me as a mommy. I have a 9-year-old daughter. Vaccination and maternal health, fertility. I'm not concerned about her in terms of pregnancy, but for those mommies who are concerned about if there are any impacts in terms of pregnant women, these questions are for you. So the first question is, why should expectant moms have the vaccine? Doctors may not have to worry about this, but poor and working class moms, who, by the way, are less vaccinated, actually do. They balance the fear of infertility for their children. Vaccine injury, not real, but it is what is propagated likely in social media. So the first thing I want to talk about is the consideration for women of childbearing age and parents who have daughters in terms of considering the COVID-19 vaccine. In social media, you will hear a lot of chatter about the vaccine being associated with infertility. This is nothing new. A lot of folks, particularly those who don't believe in vaccines or are completely opposed to vaccines, any new vaccine that's come out in the almost 20 years that I've practiced, especially when it came to the meningococcal vaccine and the HPV vaccine, there were all this social media messaging about each of these vaccines causing infertility, and it's absolutely not the case. There's certain what we call moves in a playbook that folks who subscribe to the anti-vaccine movement always push out. They always talk about vaccines causing infertility, vaccines serving as population control, vaccines causing autism, and then a wide array of other issues. And what I will say is I see the same messaging happen with every single vaccine that's new that has come out since I started practicing pediatrics. What I will tell you in terms of the vaccine, first, in terms of infertility, what we know starting out with the clinical trials, the Pfizer clinical trials, was that within the vaccine group, 26 women got pregnant, which is excellent. And they were able to carry their pregnancies to full term. Within both the vaccine and placebo group, there were 6 miscarriages, only 2 of them in the vaccine group, 4 of them in the placebo group, right? There were more miscarriages for women who didn't receive the vaccine than those women who did. The American College of Obstetrics and Gynecology, the Association of Fetal and Maternal Medicine, adolescent gynecology organizations, all of the organizations that represent obstetrics, gynecology, and women's health have all pushed out statements in support of women of childbearing age, adolescent girls, and now our little ones between the ages of 5 and 11 of getting the vaccine. We've looked at over now 18 or 12 months of data 18 months, if you include the clinical trials, to see whether or not women who got the vaccine had struggles with infertility at a higher rate than women who did not get the vaccine. And we have not observed any differences in issues with infertility. What I will tell you is we have to pay attention to what happens when you have COVID. So I always say, folks always compare vaccine to general population. What I always tell parents and adults who are considering the vaccine is you really have to consider getting vaccinated versus what COVID does, right? What we know that COVID does, especially with pregnancy, is that COVID-19 increases a pregnant woman's risk of dying. COVID-19 infections increase a pregnant woman's risk of losing the baby, whether middle through the pregnancy all the way to the end. COVID-19 infection increases risk of pregnancy-induced high blood pressure and pregnancy-induced blood clots. Several of my colleagues who are in obstetrics and gynecology have lost patients just recently to COVID-19. And so that's what we have to consider either as adults in thinking through this vaccine or as parents in thinking through this vaccine for our children. For me, having a daughter, certainly thinking through, is there a risk of infertility, but knowing and paying attention to the data, I feel comfortable in trusting that she will be safe, and that now she's 9, like 20 years, 25 years from now, when she's considering being a parent, that this will not impact her that far out. Since we stopped using live polio vaccine, we have not seen any vaccine where we did not observe adverse outcomes immediately after starting to administer the shot. There has not yet been a vaccine that we've administered where nothing happened, and then all of a sudden, 10, 20 years later, the badness shows up. We would see the badness, especially now that billions of people have now received these vaccines across the globe. We would have seen some issues. I will tell you, parents, there have been some changes in menstrual cycles, and I'll say a change in a menstrual cycle is not the same as a medication or a vaccine causing infertility. Some women who have had the COVID-19 vaccine have observed changes in their menstrual cycle, maybe a little bit heavier bleeding or a longer period immediately after having received usually the second dose. The NIH is actually committing some money to figuring out what the reason is. The speculation is that because COVID-19 and the vaccine trigger a pretty strong immune response, anytime you trigger an immune response, you also trigger an inflammatory response. So the body's inflammatory stuff, it goes from like level 2 to like level 10. And for any of you women who've ever been stressed, had any issues, you know your period changes, whether it disappears or is super heavy, it likely is a reflection of what's going on internally inside the body. But I want to make sure that I'm always transparent in acknowledging some of the things that have come up with the vaccine. But again, a change in a menstrual cycle for that period immediately following your vaccine does not equate to infertility issues. We have looked at data in terms of women seeking out IVF. There have been no differences in success rates between women who have been vaccinated against COVID compared to the general population. They've looked at women who've gotten pregnant since getting the COVID-19 vaccine, and we have not seen any differences in terms of fetal loss, maternal mortality, any of those things. But we certainly have seen the impact of COVID-19 on pregnant women. The other beautiful thing about getting vaccinated as a pregnant person is you get to pass on antibodies, because breast milk is liquid platinum, and you pass on antibodies in babies who would otherwise not be protected. So that's yet another reason why we as pediatricians, as OBGYNs, and as mommies in these clinical spaces highly recommend that for women who are of childbearing age and women who are pregnant, that they consider getting the COVID-19 vaccine. Another question was, I'm already vaccinated, but I'm breastfeeding. Should I get my booster shot or wait until breastfeeding is done? Just answer that question. Get your booster so that the baby can be boosted too. I breastfed until my daughter was 2.5 years old. So any extra boost, any extra protection, especially as we're getting into the winter months, is going to be essential for our little ones. All right, so I want to stop there. Hello, Mrs. Caldwell. Welcome, welcome, welcome. Let me know as we're going through this process if you guys have any questions. Stop me, raise hand, unmute. We have a nice intimate circle. So I welcome you guys to just have conversation with me. Just jump in whenever. Next set of questions, safety post-vaccination. After being fully vaccinated, does my child still need to wear a mask to school, We live in Texas and our school district does not require masks. That's an excellent question. There are two reasons why I'm going to tell parents that our children still need to wear masks. The first is that although the vaccine does an amazing job of doing two things, preventing us, inclusive of our children, from getting severely ill, needing hospitalization, or risking dying from COVID, right? Our vaccines are not perfect in terms of what we call breakthrough infections. They did not study whether or not COVID-19 protected us from the infection once exposed. Scientists would have had to expose people to COVID in the vaccinated and unvaccinated groups in order to have that question answered during the phase 3 clinical trials. Number one, it would have been unethical because we still were figuring out whether or not the vaccine worked. Two, we didn't have time because hundreds of thousands of people were dying in this country alone. And so it was critical for us to be able to provide a vaccine that decreased severity of symptoms and decreased the risk of death. It's in real time that we're now learning how well the vaccine protects us from actually getting COVID once we've been exposed, but it's not perfect, right? We estimate that around 10% or so of people who've gotten the vaccine will still get COVID-19. And when you're dealing with the Delta variant, which it has been like the biggest, baddest version of COVID because it's more infectious, it has more virus associated with it. So you get more bang for your buck when you're near somebody who has the Delta variant of COVID. It increases your risk of getting infected, even in the face of being vaccinated, just because there's more virus that you're exposed to. So for that reason by itself, it's still important for our children to wear a mask until we can bring our numbers down, depending on where you live. Even if you live in a place like Vermont, Rhode Island, anywhere in the New England states where they have done a phenomenal job of vaccinating their population at somewhere around 72% of their population is fully vaccinated, that's still not what we call herd immunity. We have to have between 85 to 90% of a population either having had the infection or having been vaccinated against COVID in order for our children to be able to take off their masks. So that's the first reason. The second reason is we're entering into the winter months. For a lot of viruses, they're what we call seasonal. It's like Christmas, right? They're seasonal. They get bigger and badder and cause more infection because they like cooler weather. It's the reason why we have flu season. Flu doesn't show up all year long. It usually shows up around September and disappears around March, right? And it's because the virus loves this time of year. We have yet to be able to appreciate whether or not COVID is truly seasonal. I will tell you that it likely is because all the other coronaviruses are usually seasonal. Because we've had so many cases, we haven't yet been able to appreciate how COVID-19 is going to behave. But what we do know is that in the winter, for the past last year, and now we're seeing it again this year, numbers continue to increase as we get into the winter months. Back in October, we were down to like probably 75,000 cases on average per day. We enjoyed that plateau. So cases they were going up and then they started to flatten. Starting last week, we started to see cases go right back up. We're now averaging over 85,000 cases of COVID per day, which means that our children, again, are going to be exposed to more COVID because our numbers are going to increase. I would keep our little ones masked up. My little one's wearing her N95 mask at school, even when she gets her vaccine, because I'm taking her when I go get my booster. Even through the winter, she's going to stay masked up, and then we'll see where our numbers are. It's speculated that we will not reach herd immunity in this country until May. Depending on where you live in your city, county, or state, you may reach herd immunity sooner. So you may be able to get your little ones out of a mask sooner. But for right now, I definitely keep their masks on. All right. And I want to make sure I pause and answer any questions that you guys may have about that. All right, mommies and daddies and other folks who are interested in kids and COVID-19 vaccines. What should life look like after my child and our entire family has been vaccinated? Can we go back to eating indoors and at restaurants? Can we go to museums? Can we travel by plane? Can we have a good Thanksgiving? Can we cut the turkey with our cousins, uncles, aunties, Nana, Pop, and be maskless, right? The answers, again, as you can imagine, going to be mixed, right? So from a family standpoint, it really depends on what's happening in your neighborhood as it relates to COVID. Here in the DMV, Washington, D.C. just removed their mask mandate. Where I live in Prince George's County, we still have our mask mandate in place because our county leaders are looking at the fact that we're entering into winter months. And we know that in winter months, cases are going to start to increase. I always say success and failure leave clues. When we look at Europe, particularly in the United Kingdom, when they started removing all of their public health measures, removing mask mandates and crowd limits, cases went up. And guess who was mostly affected? 5 to 14-year-old children. So clearly we have to protect our little ones. Does it mean you can't go to a restaurant? Not at all. Have I not taken I've taken little mommy to a restaurant? Yes, I have. But we have our masks on, food arrives, we get our little grub on, we finish our meal, and then we put our mask back on as we leave. I feel comfortable even with her not being vaccinated because my county has done such a great job in terms of our percent positive, meaning of all the tests being done, how many of those are positive. We're at less than 5%. And what is our daily average case rate? The goal being less than 25. Here in the state of Maryland, we're in what we call the yellow zone, where there's no more than between 1 to 9 cases per 100,000 residents within that week's period of time. So it's important to pay attention to what's happening in your city or county to know whether or not you guys can actually move about the building. In terms of holidays, what I would say is have conversations like now. Don't wait till Wednesday night and you're packed up and you're like, wait, let me find out if everybody's vaccinated. Ask the question now. What is the protocol? Is everyone required to be vaccinated? Are we going to be masked up until we eat? Are you requiring 24 to 48 hour testing? Are you going to do some home-based testing there? They get to stop off at the porch, swab up. If they're yes, if they're negative, they get to come in and get a plate and cut some turkey and have some pie. If they're positive, they get booted right back to their car and they get a to-go plate. So it's important to have those conversations now so that you, one, protect yourself and your children, and you protect those around you who may be participating in Thanksgiving with your family. All right, let me make sure I don't miss anything. Let's see. Let me scroll. These are good questions. I'm gonna pause and ask some of these questions. So do you recommend the vaccine for our kids? And are there any instances where you do not recommend or recommend to wait? That is an excellent question. So I do recommend the COVID-19 vaccine for our little ones. We now are approaching a little over 1 million children who have now, between the ages of 5 and 11, received the vaccine. Now, when the FDA first met, and they were basing it on the Pfizer clinical trial with like 2,200 children, I was like, that sample size is small. Like, we didn't have enough children in the study to truly be able to see if there was true risk of myocarditis, which was the most concerning side effect in this particular age population. But as we continue to see children getting vaccinated and the numbers increase without us seeing an increased risk of myocarditis specifically, because that's what we saw with the adolescent population, it gives me peace as a parent, and it gives me assurance as a pediatrician that I can recommend our children getting this vaccine without any hesitation. My rule of thumb is somewhere around 10% of the population getting vaccinated so that we truly have a clear understanding of where we are with safety issues around this vaccine. We're halfway there, because I'm not going to fake the funk and tell you I got my little one vaccinated immediately when the shot first came out. But what I will tell you is people that I know personally, colleagues and friends and like sorority sisters in my circle, one of them being someone who actually had their child in the clinical trial. And I just take my hat off to her and love her to pieces, because she, being willing to put her son in the clinical trial, allows the rest of us parents to feel more confident in being able to get our little ones vaccinated. So that's one of the reasons why I feel much better with our little ones 5 to 11 getting this vaccine. The second is that they were purposeful in determining what was the appropriate dose. I think the FDA should compel Pfizer to revisit the adolescent dose to see whether or not they need a lower dose, especially given the fact that the pediatric dose is only 1/3 of the adult dose, right? So the pediatric dose is 10 micrograms. The adult dose that some of you may have received was 30. Teenagers got the same 30 microgram dose, but we also saw an increased risk of myocarditis in that age population, partly because adolescents are at higher risk for myocarditis, inflammation of the heart muscle anyway, but also because they did show that they had increased risk of myocarditis in association with the vaccine compared to the general population. I will add that the risk of myocarditis in this population, in the adolescent population, is even higher for COVID-19. 1 in 1,000 people get myocarditis with COVID-19 infection, and it's a very severe case of heart inflammation. 1 in 9,000 people get myocarditis in association with the vaccine, and it's a very mild case. So those are the reasons why I would feel comfortable in getting little mommy vaccinated. Let's see, let me make sure that I didn't miss anything. Do you believe there has been enough studies done to ensure this vaccine is not harmful to our little ones now or in the future? That's an excellent question as well. A couple pieces of reassuring information is that, one, the children who participated in the clinical trials, Pfizer is obligated to follow them for the next 2 to 3 years, number one. Number two, the FDA required both Moderna and Pfizer to add additional children to the study and to increase the length of time that they were followed. So the FDA only reviewed information from 2,200 children, but Pfizer actually, over 90 sites, had over 4,000 children participate in the full clinical trial. We will have that information available to us likely at the end of December, beginning of January. But as I mentioned, because we now have reached over 1 million children who have gotten this vaccine, and we have not heard in mainstream media, social media, in health reports, journal articles, news alerts, because with myocarditis, within a week, we got an alert through the Department of Health, through the Maryland State Board of Health, an alert about the risk and the concern for myocarditis. The same thing with the Johnson & Johnson blood clot. It didn't take weeks. It took like 5 to 7 days for us to collectively receive notification that there were any concerns. You know, because Mrs. Caldwell knows me personally, you know that if there are any alerts, any concerns, I will definitely make sure that you guys are made aware of it, both in terms of my social media platforms. I also have the opportunity to speak specifically with the Black News Channel. We talk a lot about COVID-19, particularly related to pediatrics. And I don't fake the funk. I don't drink the big pharma Kool-Aid. I will let you guys know, all right? Let's see. What else? I want to make sure I don't miss any of these other excellent questions. What are the risks for kids between 5 to 12 taking the COVID-19 vaccine? What I will tell you is the risks associated with the vaccine are no different than for adults. The most common side effects for the 5 to 11-year-old population were the same similar side effects that we have as grown-ups. Pain at the injection site, redness at the injection site, a little bit of swelling of the lymph nodes, particularly underneath the armpit, but that's what's supposed to happen because the lymph nodes is where the party happens. That's where all your immune response cells get to show up and show out. Sometimes a little bit of fever and a little bit of what we call malaise, where they just feel a little achy all over. Of the 2,200 children in the Pfizer study, there were no adverse outcomes like Bell's palsy, which is partial paralysis of the face. There were no issues with Guillain-Barré, which is partial paralysis of the lower part of the body. There were no issues with blood clots either. And we have not seen any of those issues as over 1 million children have now gotten the vaccine. So what I would say is that the concerns are no different than in adults, but we have not seen either in the study population or in the 1 million+ children who've gotten the vaccine, any what we call adverse outcomes. So side effects are the things you expect. It's like when you take Benadryl and you get sleepy, you expect to get a little sleepy with Benadryl. Same thing with vaccines. You expect to have maybe a little soreness of your arm, a little bit of redness or warmth around the arm, even a little bit of just feeling kind of funky for about a day or two. Adverse outcomes are those significant health issues that would likely have you call your doctor, have you go see your healthcare provider or go to the emergency department, like blood clots, facial paralysis, myocarditis, etc. But I want to talk a little bit about myocarditis just so that as you guys decide on whether or not you're going to get your kids vaccinated, what you look out for. So as I mentioned, myocarditis is inflammation of the heart muscle itself. You can also have something called pericarditis, which is inflammation of the area around the heart. What you'll look for, it usually happens after the second dose of the vaccine, and it usually happens around 5 days later. Little ones will develop fever. They will complain of some chest pain. They may complain of shortness of breath where it's difficult for them to breathe. If they could go up a flight of stairs without any issues with myocarditis, they will seem sluggish and it'll be hard for them to do that same level of exercise. For any of those issues, you definitely want to reach out to your healthcare professional so that they can talk you through it, get your child seen, and if need be, have them seen in the emergency department. But it's usually associated with fever, chest pain, some shortness of breath, and change in their tolerance in terms of exercise. All right. So those are the things to look out for as mommies and daddies and guardians. Okay. Let me see. Let me scroll it. Let's see. Sometimes we have people in a household who will not get vaccinated if they get sick. How do we protect others? This is the reality. You're absolutely right, Mrs. Smith. This is the reality. I think the first thing to do is, even before folks go out and do their thing and bring cooties into the house, it's having a conversation with family members. As we're going into the winter months, all we have to do is look at Europe now or us last year. We know COVID cases are going to be on the rise. If they make a conscious decision that they don't want to get vaccinated, the rule of thumb is two things. One, they got to stay masked up to protect everybody else. I have a friend now whose brother is fighting for his life on 100% oxygen, and they're not sure if he's going to make it. So this is not a game. People are still, particularly Black people, are still dying from COVID-19. So it's having a rule, like if you don't want to get vaccinated and you want to come to the house, you got to mask up. And because the federal government has now made home-based testing much more affordable, I would go to Walmart, Walgreens, CVS, if you can afford it, have a couple of home-based tests. Every once in a while, you're going to get swabbed, brother or sister, because what you're not going to do is get me, my baby, my grandmother, my great-grandmother. This is not how we're going out. So we're going to make sure we have a protocol in place to keep everybody safe. You ain't got to go home. You ain't got to get the shot. But what you do have to do is protect everybody as you are out here living your best life. And even for myself as a healthcare provider, I test myself regularly, even in the face of getting vaccinated. Because the last thing I want to do is get my patient sick, get my daughter sick, or get my mother or any of my loved ones sick, and it be me because I was not cautious and prudent about making sure that I knew what my status was. All right. But I think that is an excellent question, because it truly is the reality. Even for Thanksgiving, it's going to be some families' reality just next week. Isn't getting severe? Yes. Talk to me.
How do we pick a home-based test? If I want to have several in the house for guests, when I go to the drugstore or whatever, do I do Abbott or what company? How do I know which one to get?
That's a very good question. Abbott is probably going to be one of the better ones. Everyone and their mother has now created a home-based test. We know that Abbott has been out the longest and has worked on what we call sensitivity and specificity the most. So sensitivity and specificity are how we know if we test positive, is it truly positive? Or if we test negative, is it truly negative? There are a good handful of tests now available through home-based testing. Even lab companies like LabCorp and Quest now have home-based tests. I can speak certainly to the LabCorp and the Quest home-based test. Their sensitivity and specificity is very good. The Abbott test sensitivity and specificity is very good. I will tell you, I have no stock to speak of. I don't have any investment in any of the companies, but those are certainly some of the top ones that you will want to pick.
Just one more question. If you've got people coming home for college and they haven't been vaccinated, should they be vaccinated now or masked? Whether they're coming home for Thanksgiving or for Christmas, how many days or weeks before coming home, if they haven't been vaccinated, if I say you cannot come home for the holidays unless you've been vaccinated, how long would that be? And that's my final question.
Oh, my sweet, you can ask as many questions as you want to. That's an excellent question. So there are a couple of layers to it. The first thing is that if they're not vaccinated and they're getting ready to come home, depending on how they're traveling, if they're driving in personal car, they need to go in and get swabbed up upon entry, right? Get that rapid test, swab them up so that you know right when they hit the door that they come into your home negative. If they have flown, caught a plane or a train, and they've been around a bunch of other people, if you test them, it will show you what their status was prior to travel. It takes between 3 to 5 days if you've been exposed on a plane, a train, a bus, etc., to then test positive. So for that person, for that child who's traveled by train, plane, or bus, I still have them masked up. They can take their mask off for Thanksgiving, but I'm gonna need you to eat over here, have your air purifier, your On Guard, essential oils flowing through your diffuser, all that stuff to decrease the risk of cooties flying around. But it would also be a perfect time to have a conversation with them about getting vaccinated. We know that the two age populations that are in the hospital now in terms of pediatrics, 0 to 4, and our adolescents. And it's been a struggle. Like only 50% of our 12 to 17-year-olds are fully vaccinated. And when you think about our 18 to 24-year-olds, the number's even lower. This is a perfect time to have that conversation. They can get their first shot. Will it protect them in the here and now? Not necessarily, because you need a good 2 weeks of time for antibodies to really mount up, right? And then you go into your third week where you get your second shot, where they're fully protected. And even after that, there's another 14 days that has to pass after the second shot for them to be classified as fully vaccinated and fully protected. So I would certainly get them tested, have a mask up if they've traveled via public transportation, and then test them with that same home-based test, and then start having those conversations with them about why it's important. I think for young folks to understand, if when adults, like I think it's like 89, close to 90% of our seniors 65 and older are fully vaccinated in this country. Over time, the only place COVID-19 will have to go is in unvaccinated populations, because the risk in the vaccinated population, there is a risk, but it's much smaller than in the unvaccinated population. So the more folks, whoever the young folks are that aren't vaccinated, COVID's like all the old heads have been vaccinated. I'm gonna go over here and hang out with these adolescents and these young adults. That's who's going to end up showing us COVID-19 in terms of infections, hospitalizations, hopefully not deaths. I pray not deaths, but certainly in terms of our infections, it will be concentrated in our younger population if we don't get more of them vaccinated. So I think this is a perfect time when they come back home.
But Dr. Yola, this is a good time for you to dispel a rumor. Yes. And Jocelyn Walker put it in the chat. Because there's a myth going around the internet that it's really vaccinated people that are spreading the COVID. And she asked, my son's father would like to know if an unvaccinated child is more likely to spread COVID versus a vaccinated child. So that's one of the myths that's going around, is that the vaccine actually has COVID in it. And can you speak to whether the vaccine has live material in it, and yep, what is the risk? You have a grandchild that's there, one is vaccinated and one is not vaccinated. Who is a higher risk of spreading it to their grandparents and their parents? Excellent. I'm going to table that, but I'll come right back to it because I want to honor Mrs. Walker and her question, and then I'll come back to that one, Mrs. Smith. Are our kids at increased risk if we wait until January, February to vaccinate our little ones? Or is there any risk to our child if we wait until the vaccine has full approval versus the emergency one they currently have? That is an excellent, excellent question. So as time progresses, particularly at this period of time, because of the seasonality that we talked about with COVID-19, based on what we know the numbers will be, right? So again, if your cutie pie is at home, not in daycare, not in school, your COVID bubble is tight when you go grocery shopping, if they come with you, they're masked up, they're protected, all those things, then technically, if you're doing all of those things, you protect them from exposure to COVID, although it's clearly not going to be perfect. But you have to be very, very vigilant, especially through the winter months, of making sure that one, their exposure is minimized at school settings, daycare settings, and even in your own home. If you have individuals who are coming into your house that aren't part of your standard COVID bubble, it again puts your little cutie pie at risk. Does it mean that you have to get the child vaccinated because you want to feel a little bit more comfortable about the vaccine and you want it to be out a little bit longer? I fully understand that. But what we have to understand is that as time progresses in the winter specifically, because we know case numbers are going to go up, that's what puts all of our children who are not vaccinated at increased risk. In terms of waiting for emergency use authorization,
What I will tell you is that it will likely not happen. So we released the adult version of this vaccine in December of 2020. We just got full FDA approval for the Pfizer vaccine in like September, a full almost 10 months. We're still waiting for the Moderna approval, right? So then that means that your little one would not get the vaccine until fall/winter of 2022. Again, putting them at increased risk because as other folks are getting vaccinated, COVID is looking for who it can infect. And it's going to preferentially infect those and cause more havoc in those who are not vaccinated. And I hear you, like I could have gotten the COVID-19 vaccine in December of 2020, but because I was like, wait a minute, I need to get a little more information. I need to do, as we say, my own research, right? Once we hit 10% of the population, because in science, 10% is an excellent sample size. If I'm doing a study, which I've done before, when I do a study, I want 10% of the population because that's reflective of the general population. It reflects it pretty well. Once we reached a 10% of the population in March is when we reached it, I rolled up my sleeve and got my shot. I'm doing the same thing with my little one. They're now at over 1 million people over a week and a half who have gotten this vaccine for their 5 to 11-year-olds. So it's beautiful that the timing works out well, right around the time that we'll likely reach 2.8 million, which is 10% of the 5 to 11-year-old population. There are 28 million 5 to 11-year-olds in this country. It will likely coincide with the time that it's time for me to get my booster. Some folks are more readily to get the vaccine earlier, and I'm grateful to them because it allows mommies like yourself and myself to be able to go into making this decision with more confidence. But what I will tell you, sis, is after about a 10% mark, we will know what we need to be concerned about with this vaccine. We're pretty close to it now in terms of the information that's currently available. If I needed to and wanted to, I could give my daughter the vaccine like this week. I wait because I want her to get the vaccine when mommy goes to get her booster. I took her with me to go get flu shots. We got flu shots at the same time. I want us to go in solidarity to go get it together. But I have confidence in knowing that of the 1 million+ children who've gotten this vaccine thus far, that there has not been anything yet that I have to be concerned about. You know, certainly most vaccine reactions we usually see within the first couple of weeks. There are some things that we will see within a couple of months. So I fully understand why you may want to wait until January or February. You have to follow your mommy gut, get the information that you need so that you can make a decision with comfort and with confidence. Because it's a lot different for us as parents. We can go get a shot in a second, but when it comes to our babies, it's like, wait a minute, the decision I make for my child, I want to make sure it's not going to impact him or her 5 years, 10 years, 15, 20 years down the line. But as I mentioned earlier, what I will tell you is that since we stopped using the active form of the polio vaccine, there has not been a vaccine to date in my almost 20 years of being a pediatrician where we didn't see anything happen. And then all of a sudden, 5, 10, 15 years later, we see it. It's not like baby powder issues, right? The Johnson & Johnson baby powder issue. I have not seen that. And collectively, we have not seen that when it comes to vaccines. I hope that helps. All right, let's see what else. How do we pick a home-based test? We talked about that. Okay, back to Mrs. Smith's other question about this rumor, this concern that vaccinated people are causing more COVID-19 infections than non-vaccinated people. I will tell you that's just blatantly wrong. And it's wrong for a couple of reasons. One, what we know is that people who are vaccinated after about 3 days have a significantly decreased amount of virus circulating in our bodies if we end up acquiring the COVID-19 infection. So number one, those of us who are vaccinated are at a significantly lower risk of getting COVID-19 in the face of being exposed. So if me and my aunt, I won't say her by name, but if me and my aunt, I'm vaccinated, she is not, we both get exposed to COVID, there's a high likelihood that I won't even get it. She has a high likelihood of getting COVID. And then if both of us get it, after about 3 days, studies have shown that my viral load, how much virus is replicating inside my body, comes down significantly because my immune system shows up and shows out to fight COVID off. My auntie, on the other hand, is over here with her ibuprofen, her echinacea, her elderberry, her essential oils, and all the zinc and vitamin C she can take, because her body is not able to have recognized COVID to be able to fight it early on. So a child who is vaccinated is certainly not shedding more virus than a child who's not vaccinated. The only concern that we had around the vaccinated population was initially some bad messaging from the CDC, right? I acknowledge it. The CDC initially made it sound like people who were vaccinated just couldn't spread COVID. That somehow, if we got exposed, COVID just disappeared. We know that's not the case. Can someone who's vaccinated and infected with COVID spread COVID? Yes, we can, but there's less of a risk of us spreading it than someone who's not vaccinated. So certainly those of us who are vaccinated, we are at less risk of getting it and less risk of spreading it, despite what people decide to say in social media. It's interesting how people come up with these thoughts. Like folks will say more people have died from getting the vaccine than died from COVID. For any of us living in this country, if 780,000 plus people died from getting this vaccine, this would have been a done deal a long time ago, right? What we do know is that over 780,000 people have died from COVID in this country, the majority of them being Black and brown. What we also know is that there have been, last time I checked the data, there are around 5,000 people of the now 200 plus million people who have gotten the vaccine and died afterwards. It doesn't mean the vaccine caused them to die. Correlation, meaning the timing of when things happen, does not equal causation, meaning if X happened, it's because of Y. Like if I get into a car accident and I had my seatbelt on and I died in the car accident, it didn't mean the seatbelt killed me. It meant the car accident killed me. You see what I'm saying? So those are the things that we have to think about. But even if it did, which it did not, even if the vaccine caused these 5,000 people to die, you're talking about 5,000 people among 200 million plus people, right? When you think about COVID-19 and the number of people that we have seen infected with COVID-19 in this country, 48 million people, right? And then 780,000 of them have died. That's just basic math. You can't argue math. You can argue conspiracy theories and population control, but you cannot argue basic math. And that's how I look at it in terms of risk. Even if those 5,000 people had died because of the vaccine, those odds are still much better than 780,000 people dying from the individuals who acquired COVID-19. All right, what ethnicity were the kids in the study, the percentage by demographics? Ooh, I'm glad you asked that question. I actually pulled up the figures because I knew a brilliant mind would ask me that question. So let's talk about it. Within the study population, because I want to make sure I didn't get the numbers wrong, nearly 80% of the children in the Pfizer study were white. Close to 6% of the children in the Pfizer study were Black. Clearly not fully representative of how we represent here in this country. 0.8% were Native American, 7% identified as mixed, 6% identified as Asian, and 21% identified as Hispanic or Latinx. So first off, kudos to our Latinx brothers and sisters for showing up and showing out to participate in the study. Two, what this also shows is that we as African Americans, one, we have a history with this country in terms of scientific experimentation. So it makes us a little bit more cautious for ourselves and our children in terms of participation. But the challenge is that if we don't participate, we don't show up in these demographics, right? I serve on the board for Children's National Medical Systems. They served as a site for the Pfizer trial. And when I tell you, the person who led the study struggled every single day to try to get Black folks to participate, please believe me, they reached out, they offered incentives, all the bells and whistles. And Black folks in Washington, D.C., in the D.C. metro area, they were like, no, I'm good. And so the challenge is if that none of us, or a smaller percentage of us, are willing for our children to participate in the studies. And when I talked to my good friend, Dr. Andrea Anderson, who's a family medicine doc out in D.C., she had the same concerns that we do as parents. But she said to herself, she said, someone has to show up and show out for us. Someone has to be willing to participate. And again, I thank her, I love her, and I appreciate her because of her commitment to science. It makes me comfortable as a mommy now getting my daughter vaccinated. All right, let's see. My son's father would like to know if an unvaccinated, so we talked about that. We answered that question. That was excellent. Thank you, Mrs. Smith, for the compliment. I so appreciate you. If your child has a positive result for the SARS-CoV-19 antibody, is the vaccine still necessary? Excellent question, Mrs. Time. The answer is yes. Even in the face of having had COVID-19 for both adults and for children, they should still get vaccinated. And I'll tell you why. One, because we're dealing with COVID-19 variants like the Delta variant. And so the body may have recognized what I call the OG COVID, which showed up back in March, but those antibodies may not as strongly recognize like the Delta variant here in this country. Now there's a Delta Plus in the United Kingdom. There's a Gamma and a Lambda variant in South America. Like we're gonna make it all the way to the Zeta variant. That's one of the reasons why even in the face of being and having had the infection, you should still get vaccinated. The second reason is that we know based on current data, even with a natural infection, after about 90 days, again, your immune response hits up, it spikes, and then it plateaus. And after about 90 days, it starts to come down. In the same way, we see the immune response start to come down after getting vaccinated after about 6 months. The really great news is that those who were naturally immune to COVID, who then get the vaccine, have a stronger immune response compared to those who got vaccinated. So you get like a double bang for your buck for those children and adults who had them. That doesn't mean go get COVID. Now, don't y'all go get COVID and then go get the shot, because Dr. Yola said you get the double protection. But in the space of having had COVID and then getting the vaccine, you get an even stronger immune response and a longer immune response. It's stronger and longer. That's like a double win. So for instance, my mom, she gave me permission to talk about her in public these days. She had COVID. And then 2 weeks later, she didn't even wait. She was like, forget a 90-day window. I'm going 2 weeks later to get this vaccine. And I will tell you, she did well after she got it, even though it was only 2 weeks after she recovered from COVID. Let's see. I hope you are on more as the flu season is in full throttle. I'm always here, Mrs. Smith. Y'all let me know whenever you need me. We'll talk through vaccines. We'll talk about immune support, nutrition, all the things that help our bodies stay strong as we fight through these cooties, all right? Let me see, we're talking about some more alerts. We're gonna have, I'm coming back. Question from a YouTube viewer. Are you familiar with the research done on vitamin D deficiency? Absolutely, I am. I think that's an excellent question. So number one, I'll acknowledge as a healthcare professional that we have not spent sufficient time evaluating nutrition and supplementation when it comes to COVID-19. Now, any of you who follow me on social media, you know that since the beginning of this pandemic, I've talked about vitamin D, I've talked about vitamin C, I've talked about B12, all the Bs, B12, B6, vitamin A, vitamin E, and zinc. What foods to eat, what foods not to eat, all of those things, but specifically for vitamin D. There were a lot of questions around vitamin D and COVID-19. What research showed was that individuals who had vitamin D deficiency, that they actually did worse with COVID-19 infections than those who did not have vitamin D deficiency. And it should be no surprise. We always focus on vitamin D when it comes to bone health, but guess what, y'all? Vitamin D is important for heart health, and it's important for immune system function. If you are vitamin D deficient, which a lot of people of color, particularly Black folks are, it puts us at increased risk for COVID-19 severity. Now, the flip side of that is folks also looked at the use of vitamin D supplementation for individuals who had COVID-19 that required hospitalization. The studies on that were plus minus, meaning some studies showed that it had a good effect, some studies showed it had no effect. I'm of the belief where if some studies showed it had some positive effect, what is there to lose, right? I take my vitamin D, little mommy takes her vitamin D. It's important for us to know our levels. So as a mommy, daddy, caregiver, make sure you know your child's vitamin D level, especially for Black children, because our children walk around vitamin D deficient all the time, especially given all the beautiful melanin within our skin. And we don't spend a lot of time outdoors, especially as we came out of lockdown. And we're now going into the winter months, right? So for all of those reasons, it's important for us to know what our vitamin D level is so that we then know what vitamin D we should be taking. As a standard, we should be taking around 4,000 international units, and that's for adults. For children, it's 400. But if you're vitamin D deficient, you're going to need more, and it's based on your age and your gender. But we have not talked enough about nutrition. We collectively, I say yes, I am giving myself a pat on the back. But for us collectively in healthcare, we have not talked about sufficiently the role of nutrition. Nutrition is important in terms of immune function. Those specific vitamins A, B, C, D, E, and zinc are important in terms of immune function and health. Things like echinacea, elderberry, all of those are essential in maintaining a healthy immune system. Getting sufficient sleep, between 6 to 8 hours. Exercising is important. Managing our stress. If our stress is on 10, that means cortisol goes up. If cortisol goes up, that suppresses our immune system's ability to develop cells and function. Sugar, let's talk about that for a minute. 25 grams, 6 teaspoons is all women need, no more than that. And for men, no more than 12 teaspoons or 120 grams. Sugar also suppresses immune cell development and suppresses immune cell function. If you have a loved one or you battle COVID, one of the first things you want to do is cut out that sugar, get you some rich antioxidant foods in, and pump up on those vitamins that we talked about. Those are all very important questions. All right, y'all, you guys are just doing so well. Let me jump back to some of these questions that were submitted before we run out of time, because then folks are going to be like, Hancock, you still didn't answer my question. COVID testing and kids. Do we have different testing for children? Short answer is no, it's the same swab. I hear there is a saliva test now. There is a saliva test, but for little ones, because it can be difficult to get in and get sufficient saliva for us to have a trusted result, the best thing to do is just the nasal swab. We no longer have to do like the brain scratch anymore. We can do it right here in what we call the nares or the nasal passages, and little ones can have that same exact test. Are there different rapid tests for children? It's the same test that we use for our grown-ups. How long does it take for the PCR to come back? It depends on the demand. When we do our PCR test, which tests for the presence of the virus itself inside the body, it can take anywhere from 2 to 4 days, depending on how many other labs are being sent to either LabCorp or Quest. But again, the beauty now is that we have some home-based testing. Talk about the rapid tests, what they are and what they are not. So there are 2 different types of rapid tests. There's a rapid test that tests for the antigen to see if you have been exposed to and have the COVID-19 infection. And there's rapid tests to assess for antibodies. If you're curious and you want to know if you've been exposed, you get an antibody test. And there's a specific window of time that you have to get it, because there are 2 different types of antibodies that show up after you've been infected. There's IgG, which is the acute antibody that shows up to show out and fight off the early part of the infection, and IgM, which shows up later and stays around. You also get IgM antibodies when you get the vaccine. So if you think you got an infection and you're curious about it before you get the shot, you can get a rapid antibody test or go to your healthcare provider and get an antibody test. As mentioned before, the other one is the rapid antigen test. That's the one you want to get to determine whether or not you are infected and infectious due to COVID-19. All right, let's see. Let me make sure I don't miss anything from the above. Someone asked about boosters. Are you fully vaccinated once you've had 2 shots, or do you have to have a booster? And will children also need a booster? Excellent question. One, you are technically fully vaccinated within that season of time, but because we know COVID-19's immune response, or our body's immune response to COVID-19 after about 6 months starts to come down, that's the primary reason for our booster. Luckily, our vaccines still work against every single variant of COVID that we have right now, but at some point in time, there may be a bigger, badder version of COVID than even the Delta version. Like we might get, like I said, all the way to the Zeta version. If our current vaccines do not trigger an immune response to protect us against Zeta, then we will also need to get a booster. I speculate, this is all speculation, it has not yet been confirmed. I speculate that every year, in the same way we have to get a flu shot, we're also going to have to get a COVID-19 shot, because we know that the immune response starts to drop down after about 6 or 7 months. Hopefully we'll get ahead of COVID-19 to be able to appreciate the seasonality of it. So we'll likely get a COVID-19 booster with our flu shot around September, October, and we'll be good through that 6 to 7 month window of time. But until we get to a place where COVID-19 is endemic and not pandemic, meaning pandemic is high numbers all across the globe, endemic is low numbers in various parts of the globe. The goal is between 5 to 10,000 cases per day. That lets us know we've done a great job of slowing down COVID-19 transmission. We are now at 87,000 cases per day. A long way to go. But back in June, we were close. We were at like between 11 and 12,000 cases of COVID a day. I was excited. I was like, ooh, my boo, Dr. Fauci said we got to get from 5 to 10,000. That's how we know we've done a good job. We were close to it. And then the Delta variant showed up and messed all of that up. And now we're going into winter months where our case numbers are starting to increase. All right. So those were the questions about booster. And will children have to get the booster too? Again, this is all speculation, not based on evidence. I want to make sure I'm clear on that because we don't know yet. But I would say yes. We do not yet know how long the immune response in our children is going to last. We won't know that until the phase 3 trial children are followed after 6 months after their vaccine. They have to get blood every 2 to 3 months, and they're monitoring what is the immune response, how many antibodies are circulating around, what are their T cells looking like. They'll continue to follow that to see if children show the same pattern of decline of immune response in the same way that grownups do. I saw some stuff pop up in the chat. Let me open it up real quick. Make sure I don't miss anything. Absolutely, get the vaccine. You don't want to have your child get sick. Yes, Mrs. Smith, you're absolutely right. Thank you, thank you, thank you. I'll make sure I answered a few more. Let me know, Kat, when we sign off. I want to make sure I get in as many as I can.
I think we're just about at time, but if you want to take one or two more, I think there was another one privately in the chat about tips for keeping the home safe, especially in small spaces, shared bathrooms, especially if someone in the house gets COVID.
Excellent question, because I think part of our conversation is the reality that some folks, even being vaccinated, folks may bring COVID home, right? So a couple of things to do. One, clearly you want to get tested and identify, and then isolate that person as much as you can, unless of course you're a parent and you can't isolate because you got to take care of your kid. Like, I'm a single mommy. If I got COVID, I would have to tap into my friends and family circle to take care of my little one, because I would not want to risk exposing her to it. And so I already have identified the individuals that I will tap into. Usually my mommy's here with me, but she's in Louisiana helping or taking care of our house damage from Hurricane Ida. So usually it would be my mommy, but because my mommy's not here, I tap into either my ex-husband so that he knows, like, it ain't no shame in my game. I'd be like, hey, I got the cootie. Come get little mommy and go get yourself tested. I already tested her. Have your friends and family circle if you are a single parent, so that you have someone who can assist. If you have no one, then it's really going to be making sure you keep on an N95 mask, making sure that you're cleaning and spraying. Lysol will be your best friend. We had an unseasonably warm day today. So being able to open up some windows to let air move out. I'm a strong believer in air purifiers. There's an air purifier in every single one of my exam rooms and in my office and at my reception desk at my office to keep the air clean. I love me some essential oils. I use doTERRA's On Guard. If you know about Young Living, you can use the Thieves oil. You can even make your own if you look online and do a little DIY. Those are things that I would do. Keep things wiped. Make sure you have your own set of utensils that you're using so that folks don't have to worry about whose fork is whose. And then keep everything in that same space. If you can, use your own bathroom. If not, if you're using another bathroom where you're brushing your teeth, keep everything Ziploc baggy. Keep your Clorox wipes. We can actually find them again. They're back at Costco and all the grocery stores. So have those wipes and make sure you're wiping everything down. Clearly, lots and lots of hand washing and lots of mask wearing until you get through your 14 days of what I call codification. Then you can get back to being the mommy, daddy, loved one that no longer puts the family members at risk. All right, let me make sure. Did we have leaving, or oh my goodness, in terms of orphans, that's a very good point. There are now 140,000 children who have been orphaned due to COVID-19. And again, a majority of those children are children of color. Our children and our communities have experienced COVID-19 in a starkly different way than white children and white community members. 680 children. I'll say this, and then I won't end it here, but I want us to make sure we know what's going on. 680 children thus far have died from COVID-19 across the country. Of those children, a little over 200 have been between 0 to 4. 400 plus have been between 5 and 18. 58% of the 0 to 4 children have been African American or Hispanic. 55% of those 5 to 18 have been African American or Hispanic. I say that for us as particularly men and women of color to have a clear understanding of our collective experience and the experience of our children. It isn't that we're more predisposed. For a lot of us, it's because we were on the front lines. We kept this country running. 75% of Black and brown people could not telework. And so what we did for a living and what we do for a living directly impacts our children. So for any of you who are working on the front lines and considering whether or not to get your child vaccinated, that's another thing to think about in terms of figuring out whether or not you want to get your child vaccinated. I think there may be one more question and then we'll wrap up. You guys asked that one in terms of family disease and how we protect everybody. If my child gets COVID, can they go to daycare? It depends on where you live. If you live in Texas or Florida, the answer is you probably could. What I would say is, as parents, and this goes to the last question that was asked, which was, as parents, how do we protect our children? How does this play out in terms of fear of death related to COVID-19 and experiencing the death of family members? I think, to be honest with you, and this is how we'll end it, is it has to be that we are our brothers and our sisters' keepers. That's, I think, the challenge in this country specifically, and people's attitudes towards this pandemic. You hear a lot about individual rights and individual choice. I don't want to wear a mask. I don't want to get vaccinated. It's my right, my choice, my body. But at the same time, this is an infectious disease that your choice affects me in the same way, for instance, that smoking does. Like seatbelts, if you don't wear your seatbelt, that's on you. You die in a car accident. But if you smoke around me, you put me at risk for lung cancer. If you acquire COVID-19 and you don't wear a mask, you put me at risk for getting COVID and then spreading it to my loved ones. So for children in school, you operate in the way that you would want someone to operate for you. If you wouldn't want someone's child to go to school with COVID because it puts your child at risk, no matter the stress that you may experience in terms of work time off, money loss, because daycare is expensive, right? Private school is expensive. You have to think about what consequence are you posing for a child who may be immunocompromised in your child's class, a parent or loved one in that child's class that may get COVID and then end up dying from it. So that's what I think about in terms of how I operate with my little one. There have been several times where my daughter had a runny nose, a fever. I pulled her out of school. I tested her. I kept her home for a couple of days. Test came back negative. I sent her back to school. As an entrepreneur, did it impact me? Yes. Did I need to stay at home so that I didn't bring her cutified self into my pediatric practice? I sure did. But I had to make the choice to protect the collective. And that's how we have to think about this as a community. All right. So that's all I got for you guys. Thank you so much for showing up. Thank you for your questions. I look forward to more conversations with you. You can follow Grapevine Health. They are on Instagram, Facebook, and YouTube. I am also on Instagram, Facebook, at YouTube, Ask Dr. Yola, just to make it easy for you, and at askdryola.com. Any questions you have moving forward, especially as you guys get closer to making a decision, any information that you hear and you want to get it vetted, questioned, etc., do not ever hesitate to ask us. That's what we're here for. The only stupid question is the one that does not get answered or doesn't get asked. No matter how outlandish it may sound, it's worthy of us discussing it. All right. Thank you guys so much. Happy Thanksgiving. Take care and protect yourself, protect your kids, protect your community. All right.